private and public hospitals in the Philippines are seeing an exodus of healthcare workers. Now, how will this affect the country? Faith Del Mundo with a story.
30-year-old Benji Foscablo resigned as a nurse in a private hospital to focus on his application abroad. He is planning to fly this year to work as a nurse in the Middle East or Europe, whichever will accept his application first.
That's the reason why a lot of our nurses are working and taking the opportunity going abroad. Kasi sobrang layo talaga. Yun nga, paulit-ulit pa natin sinasabi yun, the compensation, the salary package is not competitive.
Benji is just one of the Filipino nurses who resigned to search for greener pastures overseas. This year, as of March 28, POEA recorded 8,000 nurses who flew abroad, and last year, more than 11,000 moved out of the country. The easing of travel and working restrictions abroad, as well as the consistent demand for Filipino nurses and their world-class performance, are other factors in the exodus of Filipino health workers that we're seeing now. But the number of nurses in the country should not be a problem according to PRC, as there are 900,000 registered nurses, but only 400,000 are practicing nursing. And based on DOH numbers as of December 2021, the number of nurses in the country is at 600,000, while the available jobs for them are just around 300,000. The only problem is the huge gap between the salary of health workers here and abroad.
For the ASEAN nations, the average salary for nurses here in the Philippines is 40,000 compared to Singapore of 234,000. So with that gap, it will really attract our nurses to go abroad.
According to Dr. Jose Rene De Grano, president of Private Hospitals Association of the Philippines, they need a number of healthcare workers, particularly nurses. De Grano said that this lack of nurses will be a cause for concern, especially in case of another COVID surge in the country. For News 5, Faith Del Mundo, we are One News.